Hello, and welcome to the demonstration for the BlackBerry format of PEPID RN Pro. PEPID is a point-of-care tool with high-density information created specifically for nurses to obtain quick, accurate information. Let's start by running through a few topics in the table of contents. Let's click on the What's New section. This lists any updates or changes to sections that we have made. PEPID updates our content every 10 to 12 weeks, and even more frequently if necessary, such as with black box warnings for medications or ACLS changes. Now let's go back to the table of contents. To do this, simply pull up the menu on your BlackBerry and select Table of Contents. Next, let's look at the General Nursing section. This section covers fundamentals of nursing, including nursing assessment, procedures, and pain management. To read more about a topic, simply select it. For instance, let's go to the Nursing Assessment. Our Nursing Assessment section contains topics such as health history and physical exam. Let's go to Information for an eye exam. Notice how when scrolling through this information, you will find camera icons. If you highlight the icon and hit the menu button on your BlackBerry, it will allow you to select this icon and take you to an image associated with the content that you are viewing, a great resource for review as well as for patient education. There is also an entire illustrations section that you can access using your menu button on your BlackBerry to get to the table of contents and then choose Illustrations. PEPID has roughly 600 illustrations in its content. By selecting the Illustrations section, you will see that we have them organized here by clinical anatomy, examination, rhythm strips, women's health and OB, anesthesia and blocks, airway, trauma, and procedures. To find an image, simply select one of these topics. For instance, if we were searching for an image of the brain, we would first select clinical anatomy, and then head and neck. You will see that we have 5 images of the brain. Let's choose cerebral arteries. This could prove to be useful when reviewing a CAT scan on a patient who has potentially had a stroke. This illustration can help determine the location of a clot or bleeding.